Okay, this talk is going to be about external hernias, including inguinal, umbilical, and incisional hernias. However, the latter two don't usually cause signs of colic. Inguinal hernias can be congenital in foals or acquired in stallions, and basically, I think everyone knows, intestines are sliding into the scrotal area. I'm not going to worry about talking about direct and indirect. As long as you monitor them, they end up being about the same, and you can look through that in your anatomy notes. If it's a foal, obviously they're colts, and there are breed predispositions. Walking horses, standardbreds, and saddlebreds all tend to have larger inguinal rings. Added to that, in foals, the passage of the inguinal canal is more direct and more vertical and wider, so it makes it more likely for the intestines to come out. There's also some suggestion that increased abdominal pressure during foaling might cause the intestines to be squeezed through the inguinal ring. Pretty easy to diagnose. There's usually visible loops of small intestine in the scrotal area, and usually these animals are not colicky. In adults, again stallions, same breeds with the same large inguinal rings, and this time the inguinal hernias usually occur after breeding activity. Adults do have signs of colic, and again loops of small intestine can be found in the scrotum. The small intestine tends to get stuck, so it becomes distended, the horse's reflux, and the testicle may also be cold and firm due to vascular compromise. With time, these horses will become tachycardic and toxic. So again, diagnosis in foals, pretty straightforward. You can see the loops of small intestine. You can palpate the loops of small intestine, and you should be able to shove them back into the abdominal cavity. The hernia should be reducible. In stallions, the biggest clue is to look at the neck of the scrotum. Most testicular conditions don't enlarge the neck, but scrotal hernias do because the intestine's passing through there. You can confirm this with gentle rectal palpation and feel something more than just the cord passing through the inguinal rings. You should be able to palpate them on scrotal palpation, and ultrasound can confirm there's intestines down in there. Complications in foals, they're pretty rare. Usually these resolve over time on their own. We don't hardly ever do any surgery on the foals. They just seem to resolve as the foals get older and the inguinal canal becomes more angulated. It is possible for the intestines to get trapped, and then the foals will become colicky and need emergency surgery. So we just ask that every day the owners reduce the hernias. There is probably a greater risk of eventration with the intestines coming out at castration with these foals. In stallions, unfortunately, they tend to have more problems. Not only is the intestine stuck in there and getting swollen and more stuck and more damaged, the testicle can get damaged because of the compromise to the blood supply. And now that they've held a portion of the intestine still, the rest of the intestines are still moving, and they tend to tie themselves up into a knot, and secondary volvulus is not rare. It's also possible for the intestines to get stuck in the scrotal area, quickly forming adhesions. So prognosis is excellent for foals and good for stallions that get timely treatment. The nice thing about these is, as with most hernias, any toxins due to damaged bowel are sequestered in the hernia, and the horses are less systemically ill. So treatment: foals, have the owners roll them up on their back each day, make sure the intestines get shoved back up in the belly, and with time Mother Nature takes care of these. Some people will manufacture a truss, kind of a figure-8 bandage around the butt area to kind of keep the intestines squeezed up in there. Those can be tricky and probably not worth the time and effort. With stallions, if you're on the farm when the inguinal hernia happens, you can try to reduce these rectally. So having somebody shove up on the scrotum and the intestines from the outside, and gently you can kind of brush the intestines as they enter the inguinal ring and see if they'll pop out. Obviously there is a risk of rectal tears doing this, and the stallion may not be all that happy about it either. Surgery is usually the way to remove these. Oftentimes we need to make 2 incisions, one in the belly to pull things through, and one in the scrotal area to clean things off and to close the inguinal ring. As we do want to close the inguinal ring as tightly as possible, we usually recommend unilateral castration so that we don't have to leave any space for the blood supply. No way to prevent these. You should be aware of breed-related risks for castration, and all stallions that present with colic should have the scrotum carefully checked. Umbilical hernias are way more common and don't usually cause signs of colic. These are more common in quarter horse fillies than in other breeds, and probably related to an hereditary tendency. We know these are inherited in other species, just has not been fully evaluated in the horse. The hernias should be reducible, should be soft swelling that's cool and non-painful, and the foal should not be colicking with most umbilical hernias. Complications are very rare. It is possible for the intestines to get stuck in the hernia, become swollen, become more stuck, and have the vicious cycle leading to intestinal damage. A rare version of these hernias is called a Richter's hernia, and that means a portion of the wall is strangulated, so only a part of the intestinal loop is caught in the hernia. And this can rupture over time as it becomes damaged and lead to an intercutaneous fistula, so the foal is draining intestinal contents out the body through the hernia site. And these foals can have some significant electrolyte derangements and obviously need surgery to fix it. The prognosis for the regular kind of hernias is excellent. So treatment. We usually wait until these foals are 4 to 6 months old before we try to fix things because Mother Nature will resolve many of the small ones on her own. There's a company in California that makes hernia belts, and these are custom fitted to the foals. You send in the measurements ahead of time. And there's anecdotal studies saying they help. I've seen no actual research on these hernia belts. The old-fashioned way is a hernial clamp. Basically, pressure necrosis is used to scar the tissue and keep the hernia from herniating, so it makes some scar tissue so the body wall is more solid. These are risky in that the clamps can fall off too soon and you can have evisceration. The foals can get sick from gangrenous necrosis, and it is possible to squeeze the intestines if you're not careful. So the ideal approach is to do surgery. This can be a field surgery or it can be sent into a referral center. Basically, it's an incision around the hernia, opening it up, pushing the hernial sac into the belly, closing the body wall over the hernial sac, and then closing the skin. So in a lot of cases, you're not even opening the perineal cavity. Prevention would be to avoid repeat breeding of horses that have fillies, especially quarter horse fillies, with umbilical hernias. Incisional hernias are closely related to umbilical hernias in how they respond to treatment and how they're diagnosed. Foals may be more likely to these type of hernias too, in that they are less amenable to restricted exercise after surgery, such as a colic surgery or previous hernia repair. If the animal got an incisional infection after previous surgery, that delays healing and makes them more prone to getting an incisional hernia, and then early exercise is known to be a culprit. Generally, there are no colic signs, and again, the hernia is soft, reducible, non-painful, and cool, and this time occurring along the previous incision. Diagnosis by palpation and ultrasound can be used to verify what kind of intestinal contents it has. Complications are minimal, although it is possible for the intestine to become stuck in the hernia. Okay, a thought question for this PowerPoint is small hernias are more dangerous than large ones. Why would that be? Prognosis for these is excellent for life. They don't usually impair the animal's ability to do what it's doing, and good for repair depending upon the size of the defect. So it is a very valid treatment just to ignore these. It's going to be hard on the owners to ignore them, but it's a reasonable treatment. Or you can close them. Smaller hernial defects can be closed primarily. Larger ones may need a mesh, just due to the size and the fact that the tissue is not as healthy as it used to be. And mesh is a foreign object and can lead to complications, particularly if it gets infected. So the best bet is to prevent these, and that's why we restrict exercise after surgery for 2 to 3 months. The body wall is very slow to heal and has a low blood supply, so we tell owners no trotting, no bouncing for a couple months after surgery. If you can minimize infection by keeping the area clean and dry and draining any early infections, that also helps, as any infection will delay healing and you're going to want to prolong that stall rest period. So your final thought question is, if it takes the body wall a couple months to heal, how long does our suture that we use maintain its strength? Here we use number 3 Vicryl or Polysorb, which is polyglactin, and a lot of places use number 2 Proline or polypropylene. So your homework is to compare how long those last with how long it takes the body wall to regain strength.